So as they're talking, if you guys have any questions, like once they're done going through introducing themselves, feel free to ask anything. That's what they're here for today. So I think we're just going to start with you guys introducing yourselves, saying your names, what school you went to.
As I said, good morning to everyone. My name is Tiana Hill. I'm originally from West Palm Beach, Florida. I moved here about 5 years ago. I attended the University of Connecticut School of Social Work.
My name is Kim Tai. I'm from Wallingford, Connecticut. I graduated from the UConn School of Nursing in 2014, and currently I work at Yale New Haven Hospital.
Morning, everyone. My name is Janaris Lopez. I just graduated this past year from UConn Dell, doing a Hartford residency, a general practice residency at Hartford Hospital right now. Originally from Lawrence, Massachusetts, but went to UConn for undergrad, went to UConn for dental, and then went to Hartford Hospital for GPR.
Hi, I'm Abhi. Abhijit Debrai, but Abhi. I am from India. I did my undergrad in chemical engineering in India. Then I worked in a copper refinery for 2 years, quit, traveled for a year, worked at a bank as a database administrator for about another 2 years, quit, got into the biomedical engineering program at UConn Stores, did my master's there, and now I'm currently a PhD student in the biomedical sciences program at the health center.
Hi guys, I'm Doug Lambert. I was a post-bac student actually before I went to med school. I was an English major undergrad at Hamilton College, and I'm a fourth-year med student now, and I'm about to go into internal medicine in the Bronx at a residency program at Montefiore.
Hi guys, my name is Jason. I started my undergrad at UConn, and I am now in the School of Pharmacy at UConn. I'm in my third year in the School of Pharmacy, and I have 1 more year to go of rotations, and hopefully I'll graduate in May of 2017.
My name is Jocelyn. I'm a second-year PA student at Quinnipiac University. I took an extremely scenic route to this career path. I graduated with my undergrad in 2004 in genetics and cell biotechnology. Actually, the molecular biosciences research was going to be my plan B if I didn't get into PA school. So we can talk about the decision-making process later. So I kind of fell into a job in embryology, like clinical embryology, making embryos for people that couldn't conceive in IVF. And I had a lot of like patient counseling experience in that profession. And that's kind of how I realized I liked the clinical aspect of the hard sciences. Not so much doing the research, but the application of that to real people. And I think that's when I realized that I wanted to do something more clinically based. A healthcare provider of some kind. And I think the biggest factors in deciding the profession that I did decide on was that it's only 2.5 years of school. And even though it is crippling debt, I will be able to pay it off.
So it took me not quite as long, but same thing. Most people, when they go into pharmacy school, they'll do 2 years pre-pharmacy and then 4 years in pharmacy school to finish up the 6-year degree. I took an extra year just kind of deciding what I wanted to do. I was thinking about all these other careers. And kind of what pushed me towards pharmacy, I realized the coursework for the pre-pharmacy, like to get into pharmacy school, I realized I liked all the courses. I mean, I really enjoyed calculus, anatomy, biochem, orgo. Those are all my favorite subjects. So I kind of figured I'd pick a major that would combine all those together. So I thought, so I picked pharmacy, and I think one of the biggest reasons is that I'm not the most like decisive person, so I kind of wanted to keep options open. And when I think of pharmacy, originally I thought it was just going to be, you know, working at CVS or Walgreens. But then I kind of realized that it's actually a really flexible career. A pharmacy degree is a pretty good basis for other career paths if you kind of don't decide you like it. So I think that was the biggest thing for me, is that there's many job prospects in a lot of different areas. So I went with pharmacy.
So as a post-bac student, I obviously made a big change in my career. I was an English major in college, and I was working on a job after I graduated that I really didn't see where it was taking me, and I was beginning to sort of figure out who I was and what I wanted out of life. So I was about 22, 23 when I decided to actually go back and start taking science courses, and so my path was very sort of graded. I sort of took it step by step. And first it began with taking some science classes at NYU, and I realized that I really loved science. I began to volunteer at a few different places. One of the major places I volunteered was in the Bronx for a psychiatric study. It was a pediatric psychiatric study where I interviewed families up in projects in the South Bronx, and sort of step by step I began to realize that medicine was a really good fit for me. So my path was a little less typical, but it came from self-understanding, knowing who I was, and also beginning to know what doctors actually do. I mean, doctors are leaders, doctors are innovators, and they spend their lives learning, and all these things were, I began to see that, and I figured this was the right choice for me.
As you have guessed, I did not quite know what I wanted to do initially. I knew I did not like physics. I loved math, I loved biology, I loved chemistry, and I realized that if I went to become a doctor as an MD, I wouldn't be able to do much math. So I figured I'd do chemical engineering. That was that. Then I got a job. I realized I do not like interacting with people much. I just sort of, once you went into engineering, it became difficult to move back to biology. So I sort of made a transition into biomedical engineering. I figured I would have enough skills to do well in there.
Once I was in college, that's when I kind of took it a little bit more seriously, and I realized I really do like science, and that's what I should like if this is the field that I want to go into. But I considered a lot of other things because I wasn't 100% sure. So I shadowed a dermatologist, I considered optometry, but when I shadowed a dentist, that's kind of when I settled in on it. I loved the idea of continuously seeing your patients. I do like people for the most part. And I really like the idea of working on someone and developing your own skills that are unique to you that no one will ever be able to take away because you've worked hard in developing these skills. I loved the idea of taking people out of pain sometimes instantly, and then you get the hugs and you get the smiles at the end. So then that's when I decided to go into dentistry sometime in college.
So why I chose nursing, I actually never thought I was going to become a nurse when I was younger and I was like applying to colleges. I never thought I would go into nursing. I actually started off at UConn as a psych and bio major, and I was thinking about going into med school, but I realized I didn't like any of my classes. And I think the biggest driving factor that drove me to apply to nursing school was the experiences of my family with healthcare growing up. Being that my parents are immigrants here with very differing views of healthcare, limited English skills, limited knowledge of just healthcare in general, and just different cultural beliefs. I think the field of nursing really was appealing to me because of the holistic view of nursing, how you don't just look at patients and see their diagnosis, but you look and try to take into account, their values, their beliefs, their socioeconomic status, all the parts about them that make them as a person and not just a patient in the hospitals, really appealed to me. So once I applied to the School of Nursing, I fell in love and I knew it was what I wanted to do.
After high school, I thought I knew what I wanted to do. I was very adamant about going into the entertainment industry. And so when I went to college, I actually majored in communications. And I did work in the entertainment industry for a while. I actually worked for BET. I landed an internship there. And I worked there for about 2 years, actually ended up working with them for a little while. And after working and going to award shows and being around celebrities, I realized it really wasn't like I enjoyed it, but I really didn't feel like I was getting anything out of it. I really didn't feel like I was doing anything for anybody, really, but myself. So, and the college that I went to was a small liberal arts college, so they really emphasized work with public service. And when I graduated, I remember there was a lady there who spoke, and one of the last things that she said and that she recommended was that whatever we did in life was to make sure that we did something that was an act of public service. And that really stuck with me and resonated with me. So after I graduated from college, I landed a job in a nonprofit organization. And I worked there for about 2 years. I was working with kids who were considered juvenile delinquents, so they had run-ins with the law or whatever, and they were out on supervision. So my job was to kind of supervise them and make sure that they completed their quarter distinctions and stuff like that. And so it was really something that I enjoyed doing. I really enjoyed, seeing them be successful once they were done with the program and seeing, them go off to college. So that kind of resonated with me, and when I started thinking about what my career goal was, and I wanted to kind of stay in nonprofit organizations, so I decided to go back to school in social work. But I knew I didn't want to do so much as direct practice, so I decided to do something more so towards the background and make where I could make real changes as far as like macro and doing stuff in policy. So that's kind of what led me to social work.
One thing I would say is be 5,000% sure that this is what you want as soon as you do. So what you guys are doing now is great. Research it very thoroughly and remember the things that you really like about this career. Because when it gets really tough while you're in school, you're gonna double think it sometimes. You're gonna, I had many moments where I was like, do I really want this? I don't know if I really want to do this anymore. So just make sure you have, if there's things that you like about your career, and if it helps to keep it written in front of you, just remember, because things are gonna get tough and then it might veer your focus somewhere else.
It's hard to go through med school sometimes and feel like it's really up to you to make it through. I mean, you have professors and you have educators, but you really have to be very, very self-motivated, and you spend a lot of time alone studying, and that's just how it is. That said, when you learn to cope with that reality, you really, I think, become a kind of strong, self-sustaining person. And it's a real transformation you go through. So while it's hard, you get through it and you kind of become something new. So be aware of that challenge, but also be aware that there's something really nice on the other end of that. You get through it and you become a really strong person because of it. So don't be afraid of that, but be aware of it. Okay.
For pharmacists is that you don't have access to the patient's health record. So as a pharmacist, you're trying to make these differences for a patient, but it's kind of hard to make definitive recommendations to the healthcare team if you don't know exactly the patient's medical problems, or you don't even know all the medications they're on, you just know the ones that they're filling at your pharmacy. So that's definitely a major challenge, and I think a way to work around that is just having good communication with the rest of the healthcare team.
I think the biggest challenges that I have run into have actually been more future career based, in that the things that I've seen on my rotations, just like our healthcare system is so broken, and like I had patients in my primary care rotation that were perfect examples of how having insurance is not the same as having access to healthcare. They could come to their primary care provider, but if anything actually went wrong, they couldn't see a specialist because nobody would see them. And it wasn't, not that it matters, but it wasn't anything that they had done. They were just unlucky. They got an illness that required treatment by a specialist, and they couldn't get in to see the specialist, and so they had to deal with their illness far longer than they should have. And there was nothing that we could do. Like, you put in the referral, and like the monstrosity of healthcare administration, it just gets lost in that abyss, and you can't push it through any faster. And I think that's the hardest thing to deal with on our end, because the reason we go into healthcare is because we want to help people. And then you're trying to help them with both of your hands tied behind your back. And so I think that's something that has been hard for me to deal with. Like, I still think about some of my patients from primary care that now that I'm almost done with my rotations, that was almost a year ago, and I can still see their faces, and like that I couldn't help them, and as a student, obviously, I probably couldn't do them a lot, but my doctor couldn't help them. It wasn't the first time he'd seen them with the same problem. You know, they'd been coming back for like a year, and this obviously is not going to be the last time I have this problem. Like, this is going to happen throughout my entire career. And I don't know how to fix it. So that's the biggest problem. I think also that having more life experience allows you to frame better questions about what it is you want. I've talked to other students before that say like field X aligns with what I want, and then I ask them what they want, and they can't answer that question. So I don't know how you know if that aligns with what you want if you can't answer the first question. So I think that all of my experience before allowed me to build a more accurate list of what I want to get out of my career. And you need to do that before you can see if your intended career fits. Yeah, I learned a lot about myself in my 20s. Like I'm 34. And I played all throughout my 20s and learned all sorts of stuff about myself that I'm glad I did, because I'm happier now for it.
So if you do this at a daytimer, just ensure that you're not just, how to say it, I don't want to say wasting it, but don't, just basically form a narrative as to why you did something. It shouldn't be, oh, this happened to me, as opposed to I did this. That helps. At any time point that you want to change your career, you have to explain why you are making that change. Believe me, no one expects someone who works in a corporate refinery to apply for a research position in neuroscience. I have to answer that question every single time, right? And you have to basically have an answer that is more or less acceptable to everybody. It can't be, oh, I just figured I'll try it out. It has to be something that, okay, I wanted to do this because. Other than that, yes, if you're not certain, please try things out. There's no harm in that. Again, it's not a waste of your time if you don't get to where you should be right away. The tour is often much, much more interesting. And I also must say, I didn't realize that I wanted the life of a PhD student or a postdoc, and it took me a while to realize that. I mean, I really want that. You can be responsible for a long, long time.
I would definitely recommend taking some time off, especially after undergrad, because I feel like you already just gave 4 years of your life. So, take some time off, enjoy, and also go out and get some work experience, because I found that a lot of people that I went to grad school with, they went, straight through, but they didn't have any work experience. So they really wasn't accustomed to what it was to work in a work environment. So I think getting some work experience, taking some time off to kind of live your life, enjoy, travel, I think that's very important. So especially if you're going to go back and go to a grad program or go to medical school, because that's going to take up a lot of your time. So enjoy some of your 20s. So.